Welcome to our tutorial on mastering multiple-choice medical coding questions using the elimination technique. In this video, we'll explore how to effectively approach these questions to increase your chances of selecting the correct answer. Let's delve into a scenario involving the placement of a centrally inserted, tunneled central venous access device with a subcutaneous pump in a 7-year-old patient with chronic illness. We're tasked with determining the appropriate CPT code for this procedure. Here is the question. A 7-year-old patient with chronic illness requires long-term intravenous access, prompting placement of a centrally inserted, tunneled central venous access device with a subcutaneous pump. This is done under sterile conditions in the operating room, with ultrasound-guided insertion into a large central vein following sedation and local anesthesia. The catheter is then tunneled subcutaneously to a separate exit site to reduce infection risk and enhance comfort. Once in place, the subcutaneous pump delivers medications or fluids directly into the bloodstream continuously, tailored to the patient's specific requirements. What CPT code will best report the procedure that was done? Here are the options. Letter A. 36,561. Letter B. 36,563. Letter C. 36,560. And letter D. 36568. At this point, you may put the video on pause to give yourself time to solve the scenario. Once done, hit that play button to see if you managed to eliminate your way correctly to the right answer. Ready with your answer? Let's see if you managed to eliminate your way to the correct one. Central venous insertion procedures are indexed between those done centrally and peripherally, commonly referred to as PICs. The range for central insertions run 36555 to 36566. On the other hand, PIC insertions range from 36,568 to 36573. Since it is clearly stated in the scenario that the CVA device was inserted centrally, any code outside of the central insertion range will be incorrect. For this reason, letter D is first to go. Centrally inserted CVAs are further indexed into the non-tunneled and the tunneled. All of the remaining choices, 36560, 36561 and 36563, fall under tunneled insertions. Within this group of codes, further distinction is made as to what is attached on the free end of the catheter. Codes 36560 and 36561 are used if a subcutaneous port is attached, while 36563 is reported if a subcutaneous pump is attached. In the question, it is documented that it is a subcutaneous pump that is attached to the free end of the CVA device. Therefore, we can easily eliminate two letter choices, letters A and C. The correct answer to this question is letter B, 36563, insertion of tunneled centrally inserted central venous access device with subcutaneous pump. By systematically evaluating each answer choice and eliminating those that do not align with the clinical scenario, we can increase our likelihood of selecting the correct codes in multiple-choice medical coding questions. We hope you were able to learn from this technique shared with you today. With much practice, this should become part of your strategy and bring you great results. Good luck on your upcoming medical coding exam.